Anchor menus, right? So these are the things that we talk about in terms of based on their condition, based on, their pathology, based on their limitations, what things can we use? I talk about plantar fasciitis all the time. It reminds me of talking about ACLs. I just had this discussion, with a group of students, and it's like, why do we talk about ACLs so much? Well, it's problematic. How many do we actually have? And of course, students in the classroom all have their computers out these days, and so they could fact check me, as I'm talking. And it's like, well, we only have about 100 to 200,000 of those a year. So population wise, it's not extensive. Same thing with plantar fasciitis. It's not even in the top 10 um, of codes that, your typical outpatient physical therapist, a chiropractor is going to see, but it resonates with a lot of people. First step pain. Why is that one so important? Well, when I hear that from a patient, I immediately will go to laser, right? It means that they don't load tolerate um, very well. And so their tissue, not bueno, no bueno, not good for, really using a high mechanical energy. And so we find that laser is going to be, basically our go-to for things like that. So these are just some of the examples of anchors that I have for plantar heel pain, tendinopathies, knee OA, low back flares. So they're all, kind of specific. And so there are examples of some really simple and easy things. Like for the knee OA, doing stairs. Is it more painful going up or is it more painful going down? Can they go from a sit to stand position? Watch them, by the way, and look at their strategies when they are getting from a seated to an upright posture position. What does their gait look like? We find that although some people can ambulate very, very well with severe knee OA, it's because they're using very severe strategies to accommodate for that. And so I want to take that into consideration because those are going to be partly my anchors as well, because I do gait analysis. What does it look like as I'm treating them, and what are some of those changes that we're going to see? So what we don't want to do is we don't want to add modalities without some metric, like what exactly it is. Now, I get it. We can look at the plausibility. So I know the pathology and the pathogenesis of this particular condition, and here's what my modality can do, and we kind of match them up. And I actually start there, right? But that can be very challenging, especially in dealing with the patients and explaining to them. And so I have a tendency to use very interesting pictures here. So I was getting my hair cut yesterday, and I go to a barber, and he's telling me about he just went to this new clinic, and he's in really really good shape, rather young guy, and mostly it's just these little things, and he needs to keep himself moving. He's got a young son, so they do a lot of things like motocross and jet skiing and skiing downhill and so on and so forth. And so he said, I went, and he's like, I said, dude, why don't you come see me? He's like, well, you don't take insurance. I said, well, I get it, and that's a whole nother discussion, and I get why he wants to do that. I've actually treated him in the past. He's a funny dude. Like he didn't want to barter, so he doesn't like owing people stuff. So I would treat him, and it's like, okay, I get a free haircut, the next two times or whatever the case may be. But in any event, he's like, he goes, it was great. They spent a lot of time with me. The second time I went back, he's like, they didn't even talk to me. He's like, they didn't even ask me anything. They didn't test for anything. They did exactly what they did the other day. And he's like, he goes, I stopped them. I said, listen, don't just do stuff because you're going to charge my insurance or I have to pay for this cash. And I'm like, oh man, you're a pleasant patient. But and so in other words, making sure that we have anchors that, you know, also the patients understand, because in those cases, and in particular with laser and shockwave, they're not reimbursable. And so we need to have some level of justification of, why they're paying for these things. And one, if you're getting them out of pain and that was your anchor, that's going to be problematic moving forward when, there are typically dysfunctional patterns that are going on.